Hey, so I wanted to update y'all on my surgery. So I am now 4 days post-op after having my vesicovaginal fistula repair surgery taken care of. I have a few more videos on what that is and how those develop and different things on my channel. So just if you want to check those out and kind of how we got to where we are today with being post-op and how that was even determined that I needed this surgery. So please check those out down below. So 4 days post-op, and I'm a little sore, to be honest. Still, the urethra I feel like is more sore than any kind of vaginal discomfort. So the surgeon does have to go into the vagina, but there's also a part of it, I believe, where he has to go into the urethra to do part of the repair to the bladder. So that cystoscopy and repair is done through that port. And it's a little sore. Walking was very uncomfortable for the first 48 hours. As soon as you sit down and stand up, definitely some sharp pain down there. I was prescribed some pretty heavy duty pain medications, but I have not felt like I needed to take those. They're just I'd rather just kind of manage the pain anyway on my own because I'm home and I can do that. So a couple things I would like to offer are just some tips on how to care for yourself and how to manage, and I think I'll demonstrate a few things as well, because this is mostly because it's something that women would experience. So kind of some tips on how to take care of yourself. A few things. I'll think of two for sure. I might, as I ramble, I might think of a few more, but I want to keep this brief. Something you're going to want to have home, at home, or as soon as you can get this, would be a walker, just a front wheel walker. I can never say that without stuttering. The reason being is because you need to be able to hang your collection bag lower than your body. So let me see if I can turn this around. Don't know if I can. I don't know how to turn it around, but basically, if you imagine just like a front wheel walker that you would be using to walk with, I don't really need it to walk. I just need it to be positioned next to me when I'm sitting or lying down in bed. I just need that next to me because you want your Foley collection bag off the floor. You don't want it on a bedside table next to you where it's like the same level as your body. It always needs to be like lower than your actual body, lower than your bladder. Otherwise, it's not going to be draining the urine, and your bladder will be filling up because there's either a tilt or something going on where it's not draining. And because this is for women, mostly women are going to be dealing with this, or people with a vagina, you will probably need some skirts or dresses. I am the biggest tomboy. I love to wear boots and jeans and stuff, and with a Foley, the tube and everything, I found it to be very difficult to do that. So just long dresses have been so comfortable and so easy, and that way if nothing is confining the tubing, you can actually see your urine draining into the tube to the bag, and nothing is being like blocked in any way. Third thing is to make sure when you are discharged to make sure they have the, I don't know what you call this, but it's basically, and I'll try to in future videos, I'll try to have pictures of all this. But basically, it's like a bracing device. It's an adhesive attachment that has a little clamp to hold the tube in place on the top of my leg. So basically, when I had my hysterectomy, I wasn't sent home with that. They just kind of took that off, and then they just sent me home, and the tube was just kind of dangling, and that's very uncomfortable. The weight of everything, particularly if and when there's urine in the tube that's draining, as you get up and walk, that weight is very uncomfortable. So please make sure you ask them to secure the tubing to one of your legs. that does help a lot. It keeps the tube straight and in the proper angle going down towards the bag. We don't ever want that to be sideways. So make sure to ask for that, because my first time around when I had a Foley for 2 weeks, I didn't have that, and it was not fun. But yeah, future videos I want to talk about just showering, getting dressed, doing things around the house, and how to kind of manage that, how to keep your catheter site clean, and hopefully to prevent UTIs or urinary tract infections while you do have a catheter in place. So I do hope to update you with all of that here in the next couple of videos. I don't want these to be too long because, again, they're just quick update videos. So I think I'll upload here in the next few days another little video on showering and dressing and how to do that safely, because there is also the ability for this tube to get caught on things as you're walking. You can trip over it as you're getting dressed. So just some safety tips, and also some hygiene and just sanity tips as well, because you're home with a catheter for 3 weeks. I get it. It's a lot, and every single thing you do is slow down just a little, because you do have that in place. And the natural way of walking and hopping up and laying down and jumping over and rolling over in bed and different things definitely are different. You are very mindful of having this, and it's uncomfortable if you move unnaturally and not carefully. So anyway, thank you so much for watching and checking in. It does get better, I promise, and you are not the only one going through this, I promise. It's not a very common issue, but I just want to put this information out there as poorly shot as possible. It's absolutely just the worst video quality, and I'm sorry. But want to pass on some information to you guys. If you're going through this, or if you have this surgery coming up in your near future, I would love to pass on some information to you, so that when you do get home, it is so much easier than it was for me. Thank you so much for watching, and take care. Bye.